Now, it's been a bit of a buzzword in the health industry, but a person's BMI or body mass index is supposed to determine whether or not that they are indeed overweight. But a number of obesity experts have begun to question this line of thought, arguing that we are over-reliant on BMIs and it's actually leading to poorer health outcomes.
Let's bring in obesity expert Dr. Terri-Lynne South from Brisbane. Firstly, Doctor, how exactly are BMIs calculated and what are they not taking into account?
Yeah, the BMI is a ratio of your weight and height. It's basically your weight in kilograms divided by your height in metres squared. And it's basically a historical measure, and it has been used in research in regards to looking at populations and the correlations with health. And where we've gone wrong is actually using BMI to for diagnosis purposes as to whether an individual is healthy or not, and that's when we're coming unstuck. There are certain populations where the BMI will either underrepresent body fatness or overrepresent body fatness, and that's at extremes of height as well as different ethnic populations. So the more we're understanding about health and its relationship with weight, the more we're realising it's complex and we need better measures rather than relying on historical BMI.
That's right, and one thing doesn't mean everybody's body is the same and should react to one generic test like a BMI test, which has been worldwide for so many decades now. Australians are reportedly being denied the appropriate medical treatment due to their BMI. Can you just give us, Terri-Lynne, some examples of this?
Yeah, it's on a number of levels, and some of it again is our equipment and technology are not keeping up with the fact that the average Australian is heavier now than what they were. So some of these limitations are because the equipment, say in the operating room or in diagnostic machines, have a weight rating from a safety point of view, and patients are now exceeding that weight. And this was, these machines were probably, brought about many years ago when the average adult weight was a lot less. Another example from a BMI point of view may be in cut-offs in regards to surgery, and that comes down to risk and safety either of the anaesthetic or the actual surgical procedure themselves. Now, I'm not an anaesthetist or a surgeon, but again, these are associations, BMI associations. BMI is a risk factor for increased surgical and anaesthetic risk, but we need to understand that it's a broad brush and we can be doing more research in trying to work out what other factors can be modified to allow someone to have the help that they need.
So in your opinion then, what would you like to see change?
I would like all primary healthcare professionals and the greater public to understand that BMI is a risk factor. It is not a black and white diagnosis telling you whether you're healthy or unhealthy. I think that it's very complex, and I'm trying to get all healthcare practitioners, particularly primary healthcare practitioners, to understand that and to use BMI just as a risk factor and then do better further investigations as to whether this is an impact on a patient's health in multiple aspects.
Hopefully we get more people on board.
Yeah, indeed.
Thank you, Dr. Terri-Lynne.